Good afternoon. When this COVID crisis began, we knew the only way we would have to fight in the first battle against this virus was to essentially prevent us gathering. We knew this would be a challenging time. We knew that we would all have to find new creative ways to go about our lives so that we could jointly attempt to corral and suppress this deadly virus. And we know that in Washingtonian, many Washingtonians, their way is the way of the Spirit. We know that people treasure religious gatherings. So this has been a difficult issue about how we simultaneously defeat this virus and maintain our congregations. And as I've said before, this crisis may affect our physical connections, but we should not allow it to stop our emotional connections. And that is one reason why we deliberately made our prohibitions in this area flexible as to meet the needs of different organizations. So I'm pleased today to announce that we will be able to ease some of the restrictions on religious gatherings in a safe way as our state continues on this journey forward. During this time, in the last couple of months, it has been very heartening to see religious congregations find ways to remain emotionally connected through electronics and otherwise. It's also been really inspiring to see many of these organizations be very active in helping their neighbors, not just those that are in their congregations. But today I'm pleased to be able to announce new additional guidance for religious groups, both in Phase 1 and Phase 2 of our plan to reopen Washington. I'm joined today by three religious leaders who will have some comments. They're Aneelah Afzali, he's Executive Director of the American Muslim Empowerment Network of Puget Sound, Rabbi Yosef Schtroks of the Chabad Jewish Center of Olympia, and Bishop Shelley Bryan of the Northwest Washington Synod of the Evangelical Lutheran Church in America. Now, we're going to announce some measures, but I do want to encourage people, if they can continue their creative ways of congregating that have been successful for them already, that would be great. So here's what our new guidance would state. For in-person services, the following activities with the appropriate health guidance can be safe to begin with. First, in Phase 1, and essentially this would be allowed throughout the state of Washington right now. So right now in Phase 1, outdoor religious services can be held on the organization's property or immediately adjacent, up to 100 individuals using face coverings. And congregations will be able to do this multiple times during the day. For areas of the state that are now in Phase 2, and that is increasing, indoor religious services will be held at 25% capacity of the facility or 50 individuals, whichever is less, again with face coverings. And again, that can be held multiple times during the day. Also, for those counties that are currently in Phase 2, in-home services or counseling at a person's residence with 5 total individuals or less are now going to go forward. And if these gatherings include people from outside one's household, everyone involved should wear face coverings. Now, these numbers exclude staff, not volunteers, needed to run the service. There are some broad aspects of this. The religious services covered in these new guidance include all worship services, religious study classes, religious ceremonies, religious holiday celebrations, weddings, and funerals. This also means there's no limit, as I've said, on the number of these events that could be held throughout the day. Now, there are certain parts of our services we'll need to defer for the moment, including some choirs. Singing in the congregation is allowed, but with face coverings. And this is because the science has been pretty clear on this, that this virus is transmitted, of course, through our exhalations. And the louder we project our voices, the farther this virus travels. So we're also encouraging congregations to see if they can maintain a voluntary log of attendees at these services. and try to retain it for a couple of weeks. This is volunteer for the folks who want to volunteer their information. And the reason for that is if an outbreak occurs, and we have seen this, unfortunately, in our churches, certainly we saw it in Skagit County, this information can be really critical to help these congregates get knowledge about their potential exposure so that they can protect themselves and their families as soon as possible. We think that makes sense because I think it's common to the texts of all faiths that we have an obligation to care for one another. We know that we have seen a lot of creativity. We know that will continue, and we have found ways for organizations that can meet the safe way of meeting, and we appreciate the things that have been going on already. Now, there are some things that make common sense and follow the science right now that we're asking folks to abide with. First, of course, we need physical distancing, and that means that we really need a full 6 feet between pews and between seats in all directions, or where people stand, and they need to be identified by markings to help people really understand the distance we need to keep for each other during the services. And of course, we need to wear face coverings. We need to make sure that employees are educated about COVID-19 and how to prevent transmission. And that includes teaching employees how to self-screen for symptoms so that people don't come in as an employee of the church and unwittingly spread this virus. Organizations will need to cordon off, clean, and disinfect areas where someone who has had potentially COVID-19 has been positive have been. And there are some good CDC guidelines about how to go about that. We also need organizations to provide the personal protective of equipment for their employees and ensure hand washing and frequent house cleaning to sanitize facilities. Soap and running water works with all faiths, I'm told. So there are additional details in the guidance we're releasing today, but that's a quick run through. And now I'd like to turn to some comments to Aneelah, Yosef, and Shelley. And let's see, would that Aneelah start our comments? Are we starting with Aneelah? Yes. Aneelah, thank you for joining us, and thanks for your help with the broader community. We've had many discussions, and we appreciate our discussions with all the faith communities.
Yes, absolutely. Thank you so much, Governor Inslee, for your leadership. And assalamu alaikum, peace be upon everybody. My name is Aneelah Afzali, and I'm with the Muslim Association of Puget Sound, or MAPS, and also on the Faith Action Network board. Based in Redmond, MAPS is the largest Islamic center in Washington, serving over 5,000 families across Puget Sound. The Muslim community recently completed the beautiful month of Ramadan. We celebrated Eid. Our mosques are usually bustling with activity during these times, with people praying, breaking fast together, and celebrating. This year, of course, was very different. We missed out on so much of the communal aspects of these blessed days, even though we did what we could with the restrictions. MAPS was the first mosque in the nation to make the difficult decision to cancel our Friday services. And we did so recognizing that we don't worship our places of worship. We worship God, and we are commanded to preserve life and uphold community well-being. The Quran states that if anyone saves a life, it shall be as though they saved all of humanity. And of course, there is a strong desire among Muslims to return to our mosques. Our hearts are longing for that, but we want to do so in a safe way without sacrificing the most vulnerable. So we welcome the new guidelines today as a step in that direction. And we look forward to continuing work with the governor's office and county officials to preserve human life and health as we find ways to safely reopen our places of worship. We cannot wait to be in phases 2, 3, and 4, inshallah, God willing. But in the meantime, because our faith values also manifest in service, we continue helping our neighbors in need. Like other mosques and Muslim relief organizations, MAPS, through our MCRC program, has been providing crisis relief, including distributing over 85,000 pounds of food to the hungry, providing over 125,000 in rent and utility help, free virtual medical services, and more. And we will continue to do that. we stand ready and committed to do our part to support safety for all and serve the greater good. We are also contemplating how to emerge from this crisis in a way that ensures a new, better reality for everybody, because normal was not okay for so many people. And with that recognition, I send prayers to some of the most vulnerable right now, including those in prison or detention, those who lost their income, those who are not covered by relief packages, the frontline essential workers, and those directly infected with COVID, as well as, of course, the governor and his team and other leaders as they navigate us out of this crisis. May faith, wisdom, and heart guide us all through this. Thank you very much.
Thank you, Aneelah. Yosef.
Thank you. Thank you very much, Governor Inslee. Thank you, Aneelah. Thank you, Governor Inslee, for your bold leadership throughout this entire ordeal, being so dedicated to the preservation of life and sparing no efforts to keep all Washingtonians safe and healthy. You know, one of the things that this pandemic has brought to the forefront is the inherent and equal importance of every individual. The Torah, the Bible, teaches that when God created the world, all other species, animals, plants, etc., were created in herds by the hundreds and thousands, but the human was the only one that was created alone. And that teaches us that every person is like an entire world. And as the great spiritual leader, the Lubavitcher Rabbi of saintly memory, once explained, that within each individual stands the entirety of the community, because the community is only complete when it is constituted by all its individuals, each with their own unique qualities, abilities, and contributions. And in the giant community that is our great state of Washington, as we faced a crisis, it was inspiring to see, especially under your leadership, Governor Inslee, how we all went to great lengths, closing our businesses, schools, and even houses of worship in order to save the lives of individuals. We may not know them personally, irrespective of who they are, because after all, we each share a divine spark. Every person in our great state is an entire world. My wife Rivka and I are blessed to co-direct the Chabad Jewish Center in the Olympia area, and we serve as the representatives of Chabad Lubavitch here in the state capitol. And your announcement today brings us great joy, as it is indicative that hopefully the worst is behind us, and it will enable our community to resume many of the core communal rituals that are central to our faith, and will enable us to draw good energies from one another, help us heal together, while still maintaining utmost care to ensure everyone's health and safety. And I imagine the news will similarly be received with great happiness by our sister communities around the state, especially with the timing of today's proclamation being just a few short days ahead of the major Jewish holiday of Shavuot. On Shavuot, we relive the giving of the Torah, the Bible, on Mount Sinai 3,332 years ago, through an annual public communal reading of the Ten Commandments. Now, of course, that couldn't have been possible this year without the decision you shared today. We plan in our congregation to go a little further than the framework you set in place today, and to add a few extra precautions, to be extra cautious, and my colleagues at Jewish communities across the state tell me that they will be doing the same based on their unique local needs and concerns. But at the same time, we remain steadfast in our commitment to be there in any way we can for the homebound and most vulnerable among us who are weathering this prolonged and challenging isolation, because although we may be physically separated, we are united as a community. I'm deeply grateful to you, Governor Inslee, and your entire team, those I interacted with, Rochelle Davis, Dante Payne, and I'm sure so many others who invested so much effort towards enabling a safe reopening of spiritual services. And may God bless you, Governor, with endless strength as you lead the battalions of elected leaders, public servants, frontline healthcare providers, first responders, and essential workers in the fight against the coronavirus. And may God bless this great state of Washington and all of its residents with health, life, and prosperity. Amen.
Thank you, Yosef. Before Shelley speaks, you just made me think of something I want to say, and that is that one of the great things about what the faith communities are doing here by acting safely, obviously they are protecting their own flock, their own congregation, the people who are in the faith facility with them, but they're protecting everybody outside of multiple faiths. You know, when a person in the Hebrew faith wears a mask that prevents the transmission from going out, that then ends up infecting a Catholic or a Muslim or any other faith, this is all truly an all faiths issue, because everything we do in the church is protecting everyone else of whatever faith or without faith, without the broader community. And that's why I appreciate the responsibility that has been shown by so many people in the faith communities. With that, Shelley.
Thank you. God's peace be with you. Like so many faith communities, we in the Christian church yearn to be back together again. As a pastor and as a bishop, my calling has been to gather faithful people and share the message of Jesus Christ. I did not accept God's call to ministry in order to tell people to not enter church buildings. But this is a strange time. As one of 3 Lutheran bishops in the state of Washington, serving in the Evangelical Lutheran Church in America, partnering with over 300 congregations, we continue to wrestle with how we are the church in the world today. You see, as Christians, care of neighbor is what frames our daily walk with Jesus. As leaders, in order to uphold the sanctity of life and protect the most vulnerable, we need to take into account that what is safe in one part of Washington is not safe in other parts. We have to hold in tension liberty and safety. Governor Inslee, I thank you so much for your careful work in establishing guidelines. And I know this has been difficult for you with the many voices you have been hearing. I think that what you are recommending holds the desire to gather and to be safe well. I would caution that as these guidelines are followed, we need to be mindful of the numbers of cases of COVID in the part of the state that we are in, the ages of the people who are worshiping, and the best practices established by the scientific community so that our worshiping communities do not spread this virus further. In the northwest part of Washington where I serve, which includes the most cases of COVID deaths in the state, I will prayerfully continue to encourage online worship, and I will patiently wait with expectation and anticipation for the day we can all gather safely in person again, when all can gather, from the most healthy to the most vulnerable, and we fill church buildings to overflowing again. I faithfully believe this is true. I strongly encourage that as people begin to gather again using the governor's guidelines, that good protocols are in place so that all are protected. As Christians, we're committed to following Jesus Christ, loving our neighbor, and we continue to be informed by the scientific community. Remember, my Christian sisters and brothers, we are being the church now. We are worshiping now. We are loving our neighbor now. We are the body of Christ now. We are being church in the world now. And God's Spirit is here. May all that we say and do reflect the love of Jesus Christ. Thank you.
Thank you very much. I appreciate it. I should note that this guidance followed many conversations with multiple congregations in the faith community, and I found a commonality in the discussions with them because regardless of their faith, they all share a commitment to their fellow people in the state of Washington, which we appreciate. So with that, happy to stand for some questions. Oh, yes. No, I think there's a few more things the state needs to know about before we stand for questions. First off, I just want to make sure people knew that our Department of Health has approved 7 more counties to move forward to phase 2. This morning, that was added to that group, Thurston, Walla Walla, and Kittitas. That means that 24 counties have been able to transition to phase 2 in our 4-part Safe Start recovery plan. Clallam, Kitsap, and Klickitat are eligible to apply. They have not applied for a step forward. We think that may be forthcoming. The variance application for Clark County remains on a pause for further discussion because they've had an ongoing outbreak investigation that we are in the middle of taking a look at that county. We hope things are able to improve. We remain hard at work determining our next steps forward as a state on June 1. We're going to have more details to share with you in the days to come. But I do, as we've been clear now for some period of time, we do not believe that every county will be able to move forward phase 2 on that particular date. We'll have more to say about this in the next few days. We know we've made tremendous progress in our state. We've remained united, and I look forward to continue to be united in this step forward in our state's onward quest. With that, happy to stand for his questions.
First question comes from Rachel with AP. looking at the phase-in process, some counties that are still in phase 1, like Skagit County, have argued that the state's eligibility metric makes it impossible for them to advance, and that the metric should be based on evidence of broad community transmission and not include cases related to close familial contacts or clusters like nursing homes. So are you considering broadening those metrics for some of those counties as we move forward? And then also related to the guidance you just issued, if there currently isn't a statewide requirement for face coverings for places like grocery stores, why require them at religious services?
Yes, well, we're going to have more to say about face coverings probably either Thursday or Friday. So we will be having some requirements for enterprises to encourage the use of face covering in retail establishments. This is very important because the science is now becoming abundantly clear that face coverings can really help reduce transmission. They can help make sure that when I wear a face covering, I protect you. And as you know, when you wear a face covering, you protect me. And so this is a demonstration of our commitment to our neighbors and the folks in our grocery stores to wear a face covering is a substantial benefit. So we'll have more to say about that probably Thursday or Friday. We do know that facilities in our faith communities can be very ripe for transmission. We saw dozens of people in one choir practice in Skagit County, in part because we know that singing is a very vibrant activity that moves that virus around, where people are close to one another for sometimes an hour or more, unlike retail establishments where it's a little shorter period of time. So it is a little different environment. And we're finding that people who want to follow the science realize that this is simply a simple thing that we can do. And it ought not to be a partisan thing either. I've been inspired by Republican governors DeWine in Ohio and other Republican governors who've said, look, this is just a common sense thing. This is not an ideological statement. It is a statement of caring for your neighbors. So that's our thinking on this. As far as broadening the criteria, we may have more to say in the future, but today we've established some criteria as we go early. There could be changes at a later date. We are still considering those. We look at this science literally on a daily basis. Yesterday, we had our most recent briefing from the Institute for Disease Modeling, which was very helpful. There was some good news in that, and we are still continuing to think about the criteria going forward. So it is possible that there will be some changes, and those changes will be based on science that we're still learning literally on a daily basis. So we'll have more to say about that in the upcoming days.
Next question comes from Joe with the Seattle Times.
Two-part question, Governor. Number one, do you stand by your Employment Security Department Commissioner Susie Levine in light of the hundreds of millions of dollars last year to fraud groups in unemployment payouts? And number two, has there been any discussion about having some counties like King County or Snohomish or Pierce make their own decisions starting June 1 or after to when it's safe to reopen?
Well, what I stand against is the moral outrage of this international conspiracy that turned the virus of COVID into the virus of crime. And these criminals deserve our scorn and our condemnation and our righteous anger. And they ought to be pursued, and they will be. And the department now is involved in a very vigorous effort. And they've taken quite a number of measures, which obviously we don't disclose so that the criminals don't learn about our activities. But I can tell you that they've been very vigorous. There has been some success in the over hundreds of millions of dollars that have already been recovered because of these vigorous efforts. And we thank some of the law enforcement activity that's been involved in that. We know that we are not the only state that has been attacked, unfortunately. And we know that not only are these people to be lambasted with the strongest language we can imagine for taking public money, but also because they've delayed our ability to help people that need help. Look, we got tens of thousands of Washingtonians right now who are waiting to get their unemployment, And that process has been delayed not only now because of the tenfold increase of claims, but because of the necessity of fighting these criminals. Now, I can't think of a more vicious activity for one person to do that to another person in the middle of a crisis caused by a virus. So I stand against them, and we're doing everything we can to fight them. The question about, you had another question about, what was your first question?
Whether there's been any discussions about having individual counties such as King, Pierce, or Snohomish make the decision themselves when it might be safe to reopen a phase 2.
Well, the counties in some sense do have the ability to maintain their own restrictions. So they do have that ability. If in fact if the state allowed Kittitas County to move to phase 2, the local officials could maintain their own health restrictions that would be more restrictive. So they retain the ability to do that. But we do need to have some statewide minimum standards for this because of the fact that these things can run across borders very quickly. And again, the difficult part of this, I think for all of us, or at least many of us, to really grasp is that we have knocked down the fatalities. Every fatality is a tragedy, but we have reduced that significantly. We've seen the rate of fatalities go down. We've had a little reduction in the rate of infections and a little reduction of the rate of people who are hospitalized. But the evidence remains clear that this can spring back very quickly. I think there was just today I read, it may have been in your newspaper, Joe, about some assessments about the King County situation, which is to some degree true in many counties across the state, that we need to replace, as we remove the social distancing, we need to effectively replace that with another weapon. And that weapon is the weapon of testing, contact tracing, and isolation. And we need to make sure that those weapons are in place and usable at the same time that we remove these social distancing rules. So the state appropriately is making sure that we have that in place as we move through these phases, and we are doing that. So I think that we are on the money. We've made substantial progress. We have, many counties right now. I don't know the exact percentage, but it is a significant proportion of our state that are now. We have 24 counties now that are transitioning to phase 2, and several in the process of making applications. So we're making real progress in our state. That should not be forgotten.
Next question comes from Essex with Kyra.
Yes, 2 questions, Governor. On unemployment, there are people who are being told that it's going to take months for them to get their unemployment checks, but the rent is really due now. What's the state doing to get them their money now? And on religion, considering the First Amendment protections of religion in the Constitution, why do you feel that you have the authority to regulate religious services at all?
Well, what we're doing is everything humanly possible for folks who need this money. Look, the frustration that people have is real, it is deep, and I know it's driving people nuts not being able to get their unemployment compensation. I don't want to sugarcoat that at all. And there's some people who've been waiting literally months to get that check. Now, some of those claims, there may be real questions about them, but one way or another, we need to get them adjudicated. So the department is doing everything possible to increasing the capacity of the department to process these claims. And unfortunately, many of the claims come in with information that make them raise questions about whether they're legitimate claims. And so that's an adjudication process. It's quite labor intensive, where people have to ask questions and get them answered to figure out if those claims really ought to be paid. So what the department is doing is dramatically increasing their capacity to do that. They've hired about 500 people already in the last few weeks, with another 300 coming on in the next couple of weeks, I believe, to have more people to adjudicate these claims. They've also come up with a plan to go through the administrative personnel and the technical support personnel that are necessary to significantly increase the capacity to process these claims. I just saw the dashboard on the status of those efforts today. It's very comprehensive, and it involves hundreds of people. Now, this frustration, let's recognize why this frustration exists. It exists because we got hit by an unprecedented event that has not happened in the last century in the state of Washington, which has increased the number of claims by a factor of 10, And I think people, even though it's frustrating, hope can understand that that's going to present us all with difficulties. So I just want to tell you, this is intensely a priority for me, and I make sure that we do everything we can to increase that capacity as quickly as we can. Now, the department has also done some things from a technical standpoint to increase its capacity. One of those things is to bifurcate the input of email and other traffic that comes in between those who simply ask questions and those who have claims, so that we can have a more intense usage of personnel to help those people who really have claims. So I spoke to Susie Levine this morning about that. She thinks there's going to be significant progress in the next 2 weeks. I believe she will be talking to you tomorrow to give you some more specific information about the goals of how fast we can increase this, and also some updates on this fraud investigation and our success so far of recovering dollars. So she'll have more for you tomorrow.
Next question comes from Jim with the Spokesman Review.
By the way, excuse me, I didn't answer Essex's second question. Essex, you asked about the faith community. Look, it is very clear in American constitutional law that the government is responsible for the safety of its citizens, and when pandemics occur and emergencies of this nature occur, that there is ability to take reasonable, carefully monitored, and acutely designed approaches to try to reduce the risk of transmission. This is quite established in American law. And now we are taking a step, I think an appropriate one and a very reasonable one and carefully thought out, to advance that, to allow these congregations to come back in a reasonably safe way. And as a pace, this is a first step. There will be more steps in the weeks to come to continue to remove restrictions in this regard. I'm pleased that we're able to do this. We know how important physical congregations are to people. So I'm glad we've been able to take this step today, but it does need to be on a step-by-step basis. And I will note that these measures do allow almost unlimited multiple congregations of people. Yes, they need to be in smaller, what you might think of cohorts, but they can be multiple in a church. And some churches may desire to do that. So we think we're on very good constitutional grounds. We're glad we've been able to work with these faith communities to take a big step forward, and I think this is a big step.
Jim, we go to you.
Thank you. Governor, some counties have been in phase 2 for several weeks now, while others remain on phase 1 without a date certain when they'll be allowed to move to phase 2. I'm wondering if we will get to a point when some counties are allowed to go to phase 3 while others remain in phase 1, or will counties that have been successful at phase 2 be kept there until the rest of the state catches up to them?
I think it's possible. We have not created any inhibition in the capacity of people going to phase 3, so those conditions might exist. So I can't predict whether they will or not, but it is possible.
Next question comes from Drew with King 5.
Good afternoon, Governor. It's safe to say that Washington remains one of the strictest states when it comes to the reopening phases. Most of the Western states in our pact have lowered their benchmarks. You say that may come soon. There are many who have said it hasn't come soon enough. Why are we still waiting?
Well, we're waiting because there's a virus that's killing people in our state. Our uncles, our cousins, our brothers, and our sisters are losing their lives because of the COVID virus. And we are taking reasonable measures to make sure that we reduce those deaths. And I know that seems simplistic, but it is the accurate statement. Each state does have some individual characteristics. We still have a meaningful infection rate in our state, unfortunately. And I wish it had been eliminated, but it still exists. We still have very active hotspots in our state. You look at Yakima County, which may have one of the highest infection rates in the western United States. And so those things can blow up in your state, and you have to be aware of those. So it is not surprising that some states will have some different provisions. We believe they are commensurate with ours. And I may note that in the last week or two, we now have got 24 of our counties that have gone to phase 2. I may note that we have now taken a big step in allowing congregations to return. We are now doing elective surgery. We've done construction, auto sales. So we've had sometimes it's difficult to compare one state to another. If you really drill down, we may not be that different with the things we've done individually for individual sectors of these communities. So I think what we're doing is both safe and realizing that we all want to get back to as much of a normal life as we possibly can. And that's the decisions we're making.
Next question comes from Jerry with the Everett Herald. Jerry, are you there? Okay, we'll go back. Next, we go to Keith with Como.
Governor, following on what the earlier questions were, given the fact that churches in Kings, Snohomish, Pierce County are still in phase 1, can't go indoors, should people be prepared to go weeks, if not months, without being able to move to phase 2 unless you lower the bar?
Well, we are hopeful. Again, this is dependent on the virus. And if we can reduce the infection rate in the virus, then we can move to phase 2. And we hope that we can do so. We hope that the measures that we were talking about are successful. We're very hopeful that the new measures that we're using can be successful. And I say new because, this is stage 2 of the effort, and we're hoping that these things can pay off, which means increased testing, which we are doing. That means increased contact testing. As you know, we have just maybe under 2,000 people ready to go on contact testing. That means increasing ability to monitor isolation so people can be safe and isolated so they don't affect other people. A significantly increased use of facial coverings and masks. And the science, fortunately, has now shown that this can be really effective in reducing the rates of transmission. One of the really good news things I'll share with you from our briefing yesterday with the Institute for Disease Modeling is that there's some evidence that people are learning to, in their own individual lives, do things that are reducing transmission, even though they're still mobile. So we think people are learning to maintain social distance when they're in some social setting. They are using more masks. They're washing their hands. And so yesterday I was really intrigued. The modelers told us that the rate of infections has not gone up as fast as the rate of mobility. In other words, we were always concerned as people started to travel more and get out more and socialize more, that the infection rate would go up sort of on a linear basis with that increased mobility. It appears that has not happened. And that's really good news because it suggests that the things we're doing right now to protect ourselves and our loved ones is actually working. So when we wear a mask, when we go to the grocery store, it's not a political statement, it's a statement that we care about everybody else in our neighborhood. So if we're asymptomatic and we have the disease and we don't know it, we don't infect our neighbor while we're shopping for eggs. And it turns out that this is being effective. And so what we're really hopeful for is that these new weapons will be effective and allow us to move forward to phase 2 in some of the counties that are not quite there yet. So no, I would not be disheartened in this regard. I would be encouraged by what Washingtonians are doing to fight this disease in our individual habits. And there's a reason to believe that can be effective. Now, the next stage, as I've said, and I would love to be able to tell you exactly what the plans are, but we're still developing them to share with you for the remaining counties.
Next question comes from Denver with the Bellingham Herald.
Hi, thanks, Governor. So I know that you said that for religious places of worship that they have to provide PPE for their staff. So for those that maybe can't get the adequate amount, is there, some guidelines or advice that you have for them? And then my second question is for the counties that are in phase 1, if there are places of worship that don't have the space outside to hold, a service, do you have any other guidance for them as well? Thank you.
Well, for the guidance for areas that don't have space, I would hope that other congregations perhaps might be able to share some parking lots or fields or lawns. We hope that that might be a possibility. Or the other thing is the creative thing that these congregations have been quite successful out of meeting electronically. I met the pastor of a church I attend on occasion in Kitsap County, who told me that they've actually increased their participation since they've been having these electronically. And I don't think that's actually too unusual an event. And then we hope that we have the blessings of getting to phase 2 as fast as we can. And I'll just note that the kind of things we do as individuals have an impact of how fast we get to phase 2. The more of us who use face masks when we go to the grocery store, the faster we'll get to phase 2. And so I hope all of us can what do they say? The best prayer is action. And we hope people can act to protect themselves. On the PPE, I really don't believe that's going to be a problem, because the PPE that's required under our labor and industries rules that do apply in any employment situation, those masks are readily available. So I really don't believe that'll be a challenge.
We have time for a few more questions. Next, we go to Austin with Northwest News Network.
Hi, Governor. I'm curious about what happens to your stay-home order on June 1st. Do you actually need that anymore, or do you envision just defaulting to whatever is mandated under each of the phases? And I'm also just curious about the 10 cases per 100,000 over 14 days metric. Other states like California or Oregon and New York are using a series of metrics like hospitalization rates, deaths, access to testing and PPE as their metrics. It's kind of a bevy of metrics to decide about the next phase. It's a very different approach in those states. If you could address those two issues, that'd be great.
It's actually a very similar approach. We just have a different phraseology. Basically, we sort of set up one gate, if you will, of the infection rate. It's the one supported by the Trump administration and the CDC guidelines, if you will, and that was the basic source of the guideline. And then we have essentially the same metrics that these other states have looked at that are evaluated in the application. So in the application, as in Oregon and California, the hospitalization rate, the hospital surge capacity, the testing capacity, the PPE capacity, all of those are looked at in the application. It's the same thing with a little different title. Now the number is a bit different, and it's something we continue to look at. As I said, we chose what the Center for Disease Control suggested, and I think that was a reasonable approach. But we'll continue to look at how successful we can be of these other measures, and I think that's the thing that's going to be very important for us, and I'm hopeful that our progress we've made will continue, that these other measures, these smart weapons, contact tracing, testing, masking, as we continue to see these be successful, that criteria could change, but we need to have that confidence that it will, because we continue to have some hot spots, and according to the modelers, we still are very much at risk. Now, every state is different. I think there's, to think that we're a homogenous 50 states is not the case. We have a higher infection rate than Oregon. It is justified for us to be a little more aggressive than Oregon is. Last I checked, at some point, we had a higher infection rate than California. So we are responding to our patients' conditions, not somebody else's patients. We owe our obligation to Washingtonians, and we're fashioning something that's good for their health.
Next, we go to Bridget with the Wenatchee World.
Governor, local leaders in Chelan and Douglas counties have filed a lawsuit against you over fear that the economy will collapse if businesses aren't allowed to reopen soon. What message do you have for residents and businesses of those two counties? What's the likelihood of those two counties being allowed to move phase 2 in June?
Well, as I said, we are hopeful that our joint success, that as citizens help out on this, that we'll be able to move to phase 2, that our joint efforts of the kind of things I've talked about, individual social distancing, contact tracing, masking, as those individual efforts kick in, we hope that's going to drive the infection rate down and that those counties can move forward to phase 2. Now, I'm glad we've taken some steps today that follows on our previous efforts of allowing elective surgery in Chelan and Douglas County, allowing construction in Chelan and Douglas County, allowing auto sales in Chelan and Douglas County, and now opening up some of our first steps in congregations to return to some degree of congregations. So we're going to continue down that path, and I'm really hopeful that our joint efforts will continue to push the ball, and there's no reason to believe that it won't, because Washingtonians have been very diligent and largely successful. Look, we got to realize kind of where we are on this journey. When we started, we were the first hit, we were the hardest hit, and we jumped on this fast, and Washingtonians put their shoulder to the wheel, and we've been able to suppress this curve. And if we continue to do this, we will get to a place where these counties to get to phase 2. And I hope it's earlier rather than later. And I think there's a reason to believe that can happen. As far as the lawsuits, look, people can challenge actions by the state. I think it's really important that we have a judicial system that has a chance to review these things. People who decide to have these issues decided by a court of law, I think should be respected. It's certainly better than just ignoring the law. Some people have just tried to think they can just ignore the law like they're above it. We have a much better way of resolving these things right now, which is to ask a judge to resolve these issues. So I don't have any umbrage that people have asked a judge to look at these issues. We believe we're on sound ground making these decisions because they're based on the health of our people and they're based on the federal and state constitutions, and what we're doing is consistent with all those things.
Next question comes from Hannah with Cairo Radio.
Hi, Governor. A couple of quick questions. One, with the new guidance that you just put out for religious services outdoors for phase 1, up to 100 people, and then up to 50 inside for phase 2, would you consider, or have you considered doing the same to allow for some graduation ceremonies? And then also, been hearing a lot from Republican lawmakers and just everyday people wondering, is there still, who think the emergency is over, the public health emergency is over, because we've cleared, hospital capacity is not a huge problem right now. So can you answer, is there still a public health emergency? And if so, what is it?
You bet. We have not actively considered graduation ceremonies, and the reason is that religion is constitutionally protected for the free exercise of it, and it has a unique constitutional position in this regard. So we think it deserves an extra degree of acuity in figuring out what is in the realm of the possible. So we have not considered a change in the graduation situation front at this moment. The emergency continues to haunt us, and I wish it was otherwise. I wish this would just go away. There have been politicians who just said this was just going to be a miracle and go away. That just has not happened, and it is not likely to happen. We have suppressed it significantly. But we still have people dying, and we still have active infection rates of 150 to 250, depending on what day it is. And we continue to have some really serious outbreaks in some of our areas. I mentioned Yakima County, for instance. South King County has fairly high infection rates if you look at it as a subgroup of King County. So the most important thing to know about this is what the scientific community tells us. Here's what they tell us. If we do not replace the removal of social distancing with a successful alternative strategy, if we do not do that, this infection rate is going to skyrocket. And that's just what the scientific community is telling us. And they have good grounds for saying that, and it's quite unanimous. We talked to different modelers. I mean, last week I looked at the Imperial College in London, the Institute of Disease Modeling, the Institutes for Health Metrics here in Washington State, and they all sort of have the same conclusion. If we give up now, this disease is going to come back big time. That's just a reality. Now, there's a way we can, quote, have our cake and eat it too. And that is that we can reduce the social distancing, come back on a phased basis of getting back together to more normal get-togethers, but replace that social distancing with a very vigorous, robust, comprehensive, and dedicated effort of these other measures that we think can work. But we need to know they're going to work, and we need to know that they actually will be in place to work. We can't say that right today in a number of these counties that still are not in phase 2. And that's the confidence that we want to have to move forward, and I hope it is sooner than later. Now, the good news is we've stood up this contact tracing effort, which is frankly huge, but we need to see it work. We need to see people who can successfully isolate. We need to take care of the families that are going to need support as they're isolating. And those are ongoing efforts. So that remains an emergency. It remains something that demands our attention, and it remains literally something that is a life and death matter. It is easy to forget. It is easy to become jaundiced to the suffering of these families. And I think sometimes it might make sense to read about these losses, that these are real people. And this is not a matter of just financial loss, it's life and death.
Final question comes from Ashley with the Chinook Observer.
Hi, Governor. My county was one of 19 that sent a letter requesting the opportunity to submit plans for how they might reopen their counties that might be different than how the state has set out in the phases. I know you guys have done the variants. Is there any chance that there might be a more something more similar to that, where they can say, you know, we'd like to open these businesses and go slightly different than the plan, but still following kind of state guidelines?
Well, I think if I understand your question, is there something you could do for like individual businesses, like a variance for an individual business? Is that what you're asking about?
More like if the counties were to submit a plan to reopen to the state, that might be different than the phases, but would have kind of justification for why they are thinking of reopening certain businesses or certain areas. Would the state be open to reviewing those as a way that counties could reopen faster and have more specific reopening guidelines for their individual counties?
Well, we certainly are if the counties meet this criteria that's set forth by the CDC and our criteria for less than 10 infections. And so once that criteria is met, then yes, there is this application process that gives counties, if I call it flexibility, on how to make sure they have these other measures in place. But we need to see that progress to be able to take a look at these alternative measures. And the reason is you have, what the scientists are telling us, I keep coming back to this because that's who we're listening to here, is that you have to get the infection rate down far enough for these other measures to be successful. And that's what we need, all of us need to focus on right now. So I hope that's going to be successful in your neck of the woods.
Any final words, Governor?
No, I just want to thank people who are all remain committed to our loved ones to try to defeat this virus. And I think we're in a stage of something I thought would be the case, which is this is actually the hardest part of this effort. This is the most difficult part, but it can be the most successful because we now have an opportunity to use new tools to allow us to resume our businesses and our lives and our churches at the same time we're using new weapons. We just got to pick those weapons up and we got to use them. And today, a mark of heroism is giving your neighbor some space on the sidewalk, or wearing a mask at work or the grocery store. These are the things that can keep us healthy and allow us to rebuild our communities. And I'm seeing it all over the state by the millions. And I think we ought to be proud of ourselves that by the millions people are doing these things across the state. It's why we have had considerable success. And I just want to thank everybody for what they're doing. And with that, I hope you enjoy our brilliant sunshine, and I hope you can wash your hands. Thank you.